Live, local. This is Fox 12 Now.
Hello everyone, this is Fox 12 Now. I'm Greg Nibbler. Thank you for joining us. We are live streaming here out of the Fox 12 Oregon newsroom, and we cover a wide range of topics on this show, and we appreciate you being a part of it. And yeah, wherever you are, thanks for joining us. So what we're going to be doing is, for this segment, talking about, well, as you can see on the screen there, prostate cancer. And it is Prostate Cancer Awareness Month. And as we're wrapping that up or reaching this part of the month, we want to make sure that people know why and how you should get screened. So we're going to do that by bringing on, well, certainly an expert who's joining us right now. We have Dr. Vinayak Muralidhar from Kaiser Permanente Northwest. And Doctor, thank you very much for being here with us. And obviously you are the go-to person to talk to about this. And so I think to start off, what do you think is one of the most important things that people should know about this?
So thank you for having me on. So regarding prostate cancer, I think there's a few really important things to know. I think the first thing is that this is a cancer that's very common. 1 in 8 men will be diagnosed with prostate cancer during their lifetime. So it's common, but it's also very treatable, and it can be caught early through screening. So men who are of age, which is for most men about 50 years old, but sometimes older, sometimes younger, based on their health, family history, some other risk factors. Those men should discuss prostate cancer screening with their primary care physician, which is most commonly done with a blood test, a simple blood test.
Wow, so it's that easy for that kind of test, really
Yeah.
simple blood test.
Just a simple blood test. Can sometimes involve more tests after the blood test, depending on what's found.
So 1 in 8, seems like a really, really high number.
It is a high number. Thankfully, many of those prostate cancers are very slow growing. Some of them don't need any treatment at all. And some of them do need treatment, but the treatments can be very effective and especially these days can have very minimal side effects, at least compared to what it was maybe 10, 20, even 30 years ago.
Wow, and that shows that progression of in the medical industry and field of just how much you've been able to reduce that. So that's great. Now, as far as I guess things that maybe people should look out for, what are some major things that people should be doing just in their regular lives in regards to prostate cancer?
Yeah, so there are not too many things you can do to prevent prostate cancer. There are some symptoms that can be associated with prostate cancer, but those symptoms are also present in a lot of people that don't have prostate cancer. So I don't want to alarm people, but some things that you can sometimes see with prostate cancer when it's advanced is urinary problems, and sometimes when the cancer spreads, it can cause pain or other issues. But most older men will have urinary problems unrelated to prostate cancer. So just because you have, getting up at night many times to pee or peeing very frequently, most of the time that's unrelated to prostate cancer. So men should not be alarmed. Most of the time it's asymptomatic when it's caught, when it's diagnosed, which means you don't have any symptoms. And that's why screening can be so important.
Yeah, I think that's probably one thing that a lot of people would associate with that just because of what they've heard before. So that's great to know that that's not necessarily going to be the case if you're having that experience. Really, you're our expert here, and so I'm just want to know, what else do you think is really important for people to know and understand when it comes to getting this screening done? I mean, what are some reasons that people don't do it? Just because they aren't aware of it, or is there anything concerns that people have that we could maybe alleviate when it comes to that?
Yeah, that's a great question. So I think there are some possible harms of screening. But those have gone down over the years. So there is a chance of what we used to call overdiagnosis, which means detecting a prostate cancer that doesn't even need to be need to be treated. So sometimes people feel like they would rather not even know about that cancer. And there's a risk of overtreatment, which means once you have a cancer, you may feel inclined to treat it, but some prostate cancers actually don't need to be treated. So then men may end up with the side effects of treatment without really a big benefit from treating a really slow-growing prostate cancer that was never going to cause them any problems. That was a serious concern, but that has gone down a lot in the past 10 years. So we're better at finding cancers that need to be treated while actually not finding cancers that don't need to be treated. So with new tools, including a really big, nice study that was just published earlier this week, we actually we don't have as high of a risk of overdiagnosis. So prostate cancers that are better left untreated, we're actually even better at not even diagnosing those now. So that's fantastic. And
great.
we're better at figuring out who actually needs treatment once the cancer is diagnosed. So the possible risks of overtreatment, meaning you find a cancer that you wasn't going to cause a problem in the patient's life, but that now you have side effects from treating that cancer, those risks are much smaller now than they were, I would say even a few years ago. So our tools to figure out who needs cancer treatment have gotten much better. And so I think the harms of screening are probably a lot lower now than they were in the past.
I mean, that's remarkable that just even in a few years that it's increased that much as far as what you're able to do and what you're able to screen out. Is that just because of the technological increase, or whether we're seeing technology obviously rapidly advance, and I'm sure there's many use cases in the medical field? Is it because of that? Is it because of any specific study that came out? I'm just curious on a personal.
Yeah, great question. There's two main reasons why things have changed. So the first is technology has improved. So we have technology that can, based on a patient's genetics and other biological markers, tell us what their actual risk of having a high-grade cancer is. And the use of prostate MRI scans before a biopsy can help identify who even needs a biopsy. So if you have an elevated PSA, that's the blood test, you may or may not have cancer. But if you get an MRI, that can actually give us more confidence that there isn't a cancer and you can avoid a biopsy, or that there is a cancer and then you can have a really targeted biopsy. So the MRI has been one thing, and then the biological tests to give us more information based on the patient's individual genetic characteristics and other things like that have also improved detection.
Wow, that's fantastic. So thank you for all the research and everything that you all do, and and keeping everybody safe and finding out about all of that. It's really is remarkable. Doctor, anything else that you want to let people know?
No, I think the most important take-home message is that men should not be afraid to talk to their primary care physicians about screening for prostate cancer, or really for anything else. A lot of men don't go to the doctor because they've been healthy all their lives, and sometimes the prostate cancer discussion is the thing that gets them in the door. So that's to talk about all the other things that they could do to optimize their health. So don't be afraid to see your physician, talk to them about screening. Things are a lot different than they were even 5 or 10 years ago. So things that you may have heard about the benefits or harms of looking for prostate cancer, some of those things could be different now. So don't be afraid to talk to your doctor.
That's great, and better to find out early and take care of everything than wait. So, well, Doctor, thank you very much. I really appreciate your time and your knowledge and input in this, and hopefully this is beneficial to a lot of people out there who maybe alleviate some of those concerns that you mentioned, and we'll get in there and get checked, because it's very, very important. Thank you so much for your time. I really appreciate you.
Thank you. I really appreciate it.
And for everybody who's watching, this is Fox 12 Now, so thank you very much for being here. We live stream throughout the afternoons on weekdays between 1 p.m. and 4 p.m., covering a wide range of topics. And if there's breaking news, we have that as well right here. We've got plenty more this afternoon, so you can find me right back on whatever platform you are on right now. You can always watch these segments afterwards and share them as well. So thank you very much for being here. I'm Greg Nibbler. This is Fox 12 Now.